Enjoy 1% merchant commission when you accept Lanka Pay cards. Contact these banks today.
Welcome to Times Online. Today we have with us Mr. Thushara Vajira Perera, Director, Sri Lanka Institute of Nanotechnology, discussing the technological developments of Sri Lanka and the new products that this space will hold in the future. Good morning, Mr. Perera. Welcome.
Good morning.
To start off with, Mr. Perera, could you explain to us the thinking behind setting up SLINTEC?
SLINTEC was formed in 2008, and the idea behind forming SLINTEC was that at the time there were many universities and some private institutions who would be doing R&D, and the government did not want to have a 100% government funded R&D space. So what they really wanted to do was merge the industry with the government side and form a sort of a hand-holding space to do R&D. SLINTEC is the first PPP, private-public partnership, formed in Sri Lanka in 2008.
How has the SLINTEC evolved over the years?
The mandate of SLINTEC is actually to do research and development of products, processes that will benefit Sri Lankans. Mainly focusing on nanotechnology at the time in 2008, but since then we have sort of a diversified, but keeping nanotechnology as the core of SLINTEC's R&D. We were not here then, we were in Biagama. We moved here in 2016 and 17 with these brand new facilities. And the unique thing about SLINTEC is actually, I would say, two things. First is actually the HR, the human resources, the talent that we have here. We have local scientists as well as foreign scientists from universities of Peradeniya, Jayawardhanapura, Colombo, Kelaniya in Sri Lanka, and we have scientists from Cambridge, Oxford, and even Harvard, bringing their expertise to do research and development. The value of SLINTEC is actually the equipment that we have. We have state-of-the-art equipment that you only find at SLINTEC. We have scanning electron microscopy, transmission electron microscopy, and many other machinery that we must have if we want to bring this nanotechnology and R&D as a whole forward. So those are the two unique things that I see, which is the most valuable things that we have at SLINTEC.
How strong is your team?
I'm as good as my team, and we have close to 80 scientists. We have PhD scientists, we have MPhil scientists, and the rest of them are bachelor's degree holders. They are unique in a way that they will bring different space onto the table. So we have people who are experts in minerals, people who are experts in biotechnology, people who are experts in battery science and sensors, and textile, and many other fields. So it's sort of the big soup, I like to call, the pot of soup that we have. We have all the ingredients at SLINTEC.
How many patents have your organization secured so far?
Since 2018, we have filed 17 patents. Out of the 17, 11 patents have been granted, and there are only few which are pending. So 17 in total. So
basically 6 are in pending mode.
Yes.
Right. How many new product developments have you had?
We call the NPD team, the new product development team, headed by a PhD scientist. Rather than talking about actual new product development, for example, if you take the mineral sector, we have a very active and busy NPD program where we are looking at development of titanium from pulmudase ilmenite. These are all natural resources that we have in Sri Lanka. We devised and owned the patent where we took the graphite and we make the graphene. And there was one aspect of SLINTEC is that generating ideas and incubating those ideas and having the intellectual property and eventually the patent. So converting graphene into graphite, we actually have the patent. That patent been sold to LOLC, and they have actually spun off a company called CGTL, who are in the same premises as we are. Now they are making Sri Lankan graphite and making graphene. If you take the natural product sector, we are working very heavily on the developing these molecules that we have in Ayurveda, and we all talk about all the good stuff about this Ayurvedic medicine, but we are actually trying to hone in what are the actual active ingredients of these Ayurvedic concoctions and what do they do. So we have some creams, for example, we have an antibacterial, antifungal cream that we have developed within SLINTEC that is working beautifully. And also we are taking our Sri Lankan black tea, the green tea, and extracting and making natural dyes out of tea. And we have one patent actually we have sold, making a tea extract and making a dye out of it. We have sensors. During the COVID season, we actually put one of our sensors into the one of the masks that we have developed, which can actually gauge the changes that you have in your pulmonary system, your lungs. So by breathing into this sensor, you can sort of see your lung functions and oxygen concentration, carbon dioxide concentration, things like that. So we are taking that one step further, the same sensor, to really look at how would the lung of a normal person be different from a lung of a patient with lung cancer or COPD. So those technologies are available elsewhere, but we are trying to use our own ingredients within Sri Lanka, sort of give a Sri Lankan solution to a worldwide problem.
How far have you gone with that type of product development?
We have actually, during the COVID season, we actually did the sensor and we achieved our goals. So we have the sensor, we know the raw material, we have the raw materials. What we are trying to do is actually sort of improving the existing technology with a couple of permutations to sort of look at the inside of the lung. So we are quite far ahead.
These are the new product developments that you have, and I also realized that you have something to do with cinnamon. Can you please explain to us about it?
So there are so many medications for diabetes, mainly been prescribed in Sri Lanka is the metformin. So before I came here, our natural product group doing some research and this endemic cinnamon that we have, they have used and they have done some experiments and they have found that our cinnamon alone will have anti-glycemic effect. By taking a pill of cinnamon, someone who's been taking 500 milligrams of metformin a day, if you were to take one pill of cinnamon at night, so you only have to take 2 pills of cinnamon, so it's compliance. A lot of people don't want to put chemicals into their bodies and because one of the issues with compliance is that. So we are giving a organic Sri Lankan product, cinnamon, so that patients can only take 2 and a third tablet will be cinnamon. So if the body gets used to it after a few months, we postulate that someone on the borderline of diabetes can take 2 pills of cinnamon and 1 pill of metformin. So that needs to be seen. We actually conducting some experiments on that.
Now we have Mr. Vasantha Lankatilaka, Research Fellow, SLINTEC, to explain about the miracle cinnamon tablet which controls sugar.
Cinnamon contains polyphenols. So these polyphenols has a property of contribute to reduce the blood sugar levels. Here in SLINTEC, we have looked into these polyphenols. We have obtained the water extract of cinnamon, and also we have done the ethanolic extract of cinnamon. We have tested both of them for polyphenols, and we have seen both of them have higher amounts of polyphenols. And if we do the steam distillation, can get cinnamon bark oil, and it's containing cinnamaldehyde. Cinnamaldehyde comes into the ethanol extract. So when we think about this water extract and the ethanol extract, these two contains these polyphenols and also this cinnamaldehyde. By doing alpha amylase and alpha glucosidase inhibition assays, and we have seen this water extract and the ethanol extract both have the ability to inhibit these alpha glucosidase and the alpha amylase. And also we have done some small rat studies using these extracts, and we have seen good results at postprandial sugar controlling. This is going to be a ready product for consumers.
You mentioned clinical trial. Have you started them?
No, actually we are in the optimization step. We know exactly what are the amounts we need to have in our tablet. I mean the amount of polyphenols, what is the amount of cinnamaldehyde should be included in our tablet, and also we need to go for proper tablet manufacturing process. There are some other excipients we need to add into this tablet. Then actually we should go for these clinical trials.
As I understand, this is one of a kind in the world.
Yeah, it's going to be, because there are few more standardization steps, a different product but based on Ceylon cinnamon in US market. So it's called, as I remember, Cineulene. So Cineulene. So they have standardized that product against a chemical called proanthocyanidine A. So actually we also have the potential to do that standardization for our tablet. So if we do that one, actually our product is go beyond, going to actually give a good challenge to that Cineulene product.
This is quite revolutionary, but you must obviously be having some challenges in putting this product out. Can you explain these challenges to us?
If you eat so much manioka, you will not have cancer. If you eat so much garlic, you can lower your cholesterol. And now we are coming up with, if you take cinnamon, you can lower your blood sugar. So what we do at SLINTEC, we hypothesize, but we don't say what the hypothesis is. We carry out experiments to prove our hypothesis. So with the cinnamon, that's what we have done. So there are published reports out there, many universities throughout the world who have actually studied cinnamon, and they have found cinnamon to have an anti-diabetic effect. So we took those findings from literature and brought it to the lab, and sort of what we're trying to do is sort of translational medicine. That means from the bench to the bed. The idea was generated on the bench, and we have carried out all the experiments on the bench, and that idea became a product, and we take that product to the bed. That's called translational medicine. So we have done the bench part. There are not that many products out there, solely cinnamon products, I meant, solely for diabetes. So I think we have the upper hand. If you are actually developing a product, you want to be at least 10% ahead of your competitor, otherwise you will always be the second. But we are not rushing into things. We want to be the one, we don't want to be one off. So we are taking our time and evaluating the data, and if we have to conduct more experiments, we will conduct more experiments to get it right.
How many such products have you done, or are you developing, exploring?
There are some confidentiality here, but I can tell you not products per se, but the areas that we are concentrating on. Antimicrobial, antifungal, we have a product that we are developing. We are doing cinnamon work, our natural product group doing lots of tea related, both the down south and upcountry tea, because we all know that tea has so many benefits, inhibiting free radicals and getting all the toxins out, and we actually studying that. We have the total whole capability to have a hypothesis and test that hypothesis we can do under one roof. So that's the beauty of SLINTEC. We don't have to take our sample, go to another lab to conduct an experiment. We can do all of that here. We are screening, like I mentioned before, these Ayurvedic concoctions, which is I'm really passionate about, because I'm an immunologist. We always hear about this Vedamahatya somewhere there, and this Vedamahatya has the cure for lung cancer or pancreatic cancer. So we obviously those Vedamahatyas will not give us the Vatorus, but the main ingredient we can find in the woods of Sri Lanka. So we actually have traveled. Last week, one scientist had to go to Monaragala to get some stuff from the jungle, and we actually doing chemistry and doing distillations and identifying these compounds and test these compounds with our sister companies next door, and we actually talking to those companies to see whether we give the compound, they will look at the effectivity, And eventually, if we really want to take it further, after seeing the effectivity and the activity, we can do a clinical trial, or we can publish a paper. The moment that you publish a paper, having worked in the US, I know these big pharma and biotech companies, pipelines are very dry. So they will definitely engage with us for further development or funding for Sri Lanka to carry out and finish the clinical trials and eventually this product into the market.
When you explain this, Mr. Perera, I have to ask this question. Has Sri Lanka got the legal framework and the wherewithal to do this, like the new product developments and things like that? Or are there challenges that you face?
This is my personal perspective on this. I think compared to other countries, they are a little bit more advanced. I don't see huge problems for a company like SLINTEC to take a product into the Sri Lankan market. I know there's a patent office that should be a very busy place. From what I know, the patent office is not that busy these days. I think we don't want to reinvent the wheel. For some of these ideas, the wheel has been invented. That's the patent office. So all we have to do is go and find that patent, and if no one has actually did anything with it, we can bring that in-house with the authorization of the patent office, and we can develop that product. Sri Lanka does not generate lots of IP, or I should say everyday IP, or that many patents. So some of the discussions that we have had with similar companies for example, in Singapore, what they do is they do the same thing. They generate IP, they create patents, and they do prototypes. And their biggest challenge is scaling up, because Singapore is a very small country. So that's the opportunity that I see in Sri Lanka. I mean, we all talk about, to come out of this economic crisis, we have to do exports. And we need to do value-added innovation and value-added exports. So going back to the Singapore story, we can do the scale-up country. We have space, we have trained staff, we have all the equipment, and their IP in Sri Lanka will be very secure, so they don't have to worry about it. The environment for generating IP and patents in Sri Lanka, the legal framework is there. It's very tight. That's how it should be. For someone or a company to really go through that process and get a patent and having IP and commercialize that, I think not that many barriers in Sri Lanka. SLINTEC is the custodian of Science and Technology Park, which we are sitting right now, of 52 acres. The idea of putting this park is for SLINTEC to collaborate with other institutions. So we are collaborating with, in the same premises, JL Morrison's, one of the subsidiaries of Hemas, the Hemas' manufacturing arm. We are collaborating with John Keel's. They are in the same building. We have Thuru, we have JAT. So it's an ecosystem of R&D. Let's have science and technology parks with similar parks in other parts of the world. For example, we have a direct beeline with Singaporean science and technology, and we will actually have one ecosystem, Sri Lankan ecosystem at SLINTEC, dealing with science and technology and developing product and commercializing those products with Singaporean partners. I think Sri Lankan companies, big companies, for example, MAS, Brandix, they have their own innovation arm. They have their own product development arm. Think beyond our shores. Think whether we can develop a product, whether we can have an international footprint. So coordinating and working with similar companies in other parts of the world, I think expedite commercializing the products that we have developed at SLINTEC. And having the patents and the IP, there are not that many hurdles in Sri Lanka, and it's very protective through the IP patent office. But I think that place needs to be just a bit more I don't want to use the word complacency. The patent office should be part of either science and technology or the education ministry. But we have not had any issues dealing with people at the patent office.
So, Mr. Perera, what more would you like to see in this space?
I would like to see, like the mandate of SLINTEC had mentioned, more private industrial partners getting involved with SLINTEC, with the government side of it. All those big companies, the blue chip companies that I mentioned about, they would fund some of the projects that they have and we have delivered. I think the government side, the rules and regulations of government monitoring, it's very lean, and they are very keen about how we do things and follow the process. Rather than doing all these innovations and IP generation, the idea is generated at the university. Then the idea will be given to a place like SLINTEC. SLINTEC will do the IP generation, and there will be, for example, let's say it's a pharmaceutical product, then it will be given to a pharmaceutical company for manufacturing. I see that happening here because we are engaged with universities, and we bring some of these ideas from the universities with the approval of the technology office, and we develop that product here at SLINTEC. The cinnamon product that we talked about, we can give it to contract manufacturing down the road at Morrison. So it's actually straight line. That's what a park should be, one-stop solution for everything. I think what can be improved, sort of a tightening of some of those rules and regulations, and really involve and commercialization. I think that's the key word. All the academic scientists doing fundamental research, but applying that to applied science and getting something commercialized is not really happening. So that's where we bridge the gap. We take the idea to commercialize. So we have a screening process to do that. I think if that sort of go beyond a bit more, I see blockbuster products, whatever the field that we choose. The most important thing for me is that utilizing Sri Lankan resources.
Thank you very much, Mr. Perera. We hope that the Sri Lankan exports will get a new lease of life with SLINTEC products. Thank you very much for joining us.